Hi everybody, welcome. I'm Ruth Ochoa and today we're going to go over the standing QL stretch. So your QL is your quadratus lumborum. If you are feeling curious, you can Google it so you can get a better image of where we're talking about. But basically, if you're someone that's experiencing discomfort or tension either above the back of the hip, next to the lower lumbar area, or around the side of the hip or even into the front, also up into the shoulder area, this is a very important stretch for you. So if you're a golfer, tennis, pickleball, anyone who's doing a lot of swinging, this is an important one for you too. So let's give it a try. We'll be standing, and if you're able to be next to a wall, that's even better. If you don't have a wall, you can still get it done, but the wall makes it a little easier. Okay, so we're gonna be stretching our right side for the purposes of this video, and then you can just repeat the process on the other side. Let me grab my timer. All right, so we're setting the timer for 5 minutes for this one. So go ahead and start off by reaching your right arm up and over your head, and you should be standing pretty close to your wall. Your palm is down, and both feet are on the ground and they're about hip width apart to start. So reach up over your head and allow your fingertips to gently make contact with that wall. See what feels best for you. Some people, their arm's going to be straighter like this. Some people might have a little more bend in the elbow. Make sure your shoulder's comfortable. Go ahead and close your eyes and start to notice what you're feeling. You may be feeling a lot of this in the rib cage. That's totally fine. Don't worry if you're not feeling it in the lower hip just yet. And then go ahead and take your right leg and place it about a half step behind the left leg and see how that feels. You can also put the right leg directly behind the left foot if you want to increase the stretch some. Remember, we want to be gentle, so you shouldn't be feeling any discomfort in your low back. And take some slow, deep breaths. By now, the wall should be supporting your hand, and you're probably leaning towards the wall some as well. Check in with the space between your right shoulder and your right hip. Think about opening that space, so lean towards the wall a little bit more, and let the foot that's on the ground support your weight. Okay, so if you're feeling like you're having to balance here, then go ahead and go back to the starting position of both feet more about hip width apart. It'll be a little bit more now. You can also experiment with moving your leg in front of the right leg in front of the left foot. So just see what feels best for you. Our modified option would be that the right leg is just greater than hip width apart from the left. Otherwise, it might be right foot behind left foot or right foot directly in front. But wherever it is, you want to keep it there, okay? And keep breathing, keep leaning to open. Remember, as we feel that lengthening, as we feel our body get longer, we just lean into the stretch a little more. The right arm should not be working, so allow the arm to soften now. The wall's there to support you. And notice what you're feeling. You might be feeling this somewhere totally different than just your QL, but that's okay. Remember, fascia, because it's connected through the entire body, will lengthen where the body needs the length. So as long as you're feeling it, you're doing it right. There shouldn't be any pain. Check your posture. And breathe. You can also do this sitting in a stool at home, or probably a chair would work fine too. And if you're seated, the legs aren't doing anything and you're just reaching over with the upper body. Should feel good. So remember, we're holding this one for 5 minutes. That may be a little much for some people. It's totally fine to start with 3 minutes or even less if it feels uncomfortable. There shouldn't be any pain. So if you feel like you're compressing the left side of your hip or low back, you need to slightly come back to center, come back to neutral a little bit. That might be a little too much. And so sometimes we have to adjust in the middle of our stretch, and that's okay. Keep breathing. Allow your body to soften, let it go. Good. Let the wall support that hand. Maybe now your whole hand is relaxed onto the wall. Maybe you're repositioning that arm a little bit. Find what feels good for you. You're doing great. Eyes should be closed. Good. Keep breathing. Remember when it feels like the rope that you're pulling on, like someone was pulling on the other end and they finally let it go and it got longer, that's your tissue releasing. That's awesome. When you feel that, just pick up that slack and take it a little bit further. Good. Keep breathing. Good. All right. So slowly now we're going to start just very slowly straightening up. Good. Bring the arm back down very slowly. I do recommend giving everything a little shake before you go to the other side. Jiggle, jiggle. Good. And so definitely make sure you do the other side. It's very important. If you were starting to feel any low back pain while you're doing that stretch, you might have gone into it a little too far, too much of an arch, or it might not be time to do that stretch just yet, and you can discuss that with your myofascial therapist the next time you see them. So when you go to treat the other side, the left arm will be against the wall, and then you can start just leaning towards the left, and eventually, if you'd like, you can bring the left leg behind or in front, or just keep it next to you. All right, well, you did awesome. Great job. Give it a try today, see what you think. Remember to be gentle, and I will see you again soon. Thank you so much. Bye-bye.